In the first phase of the fight against the COVID-19 pandemic, Vietnam demonstrated its capacity to manage and implement infectious disease prevention and control activities, and the consensus of all levels of the government and the people. However, the situation is getting complicated in the world as well as in Vietnam. Therefore, in this August, the Population Services International Vietnam (PSI Vietnam) launched the project Mobilizing the Private Sector Engagement in the Public Health Response, abbreviated as PEPFAR. The project is co-sponsored by the British Department for International Development and Unilever Group and is implemented by PSI Vietnam. The project is expected to be implemented in 4 provinces and cities including Hà Nội, Bắc Ninh, Hà Nam and Thái Nguyên.
Cũng như là cái tên gọi của dự án, mục tiêu của dự án là muốn huy động và mong mỏi cái sự tham gia đóng góp của khối tư nhân vào các cái biện pháp phòng ngừa các cái dịch bệnh và góp phần vào cái công cuộc là giám sát các cái dịch bệnh ở Việt Nam. Đối với lại cái đại dịch Covid thì cái khối tư nhân mà chúng tôi muốn nói đến ở đây cụ thể là các cái phòng khám tư nhân và các cái cơ sở dược và các cái hiệu thuốc, bởi vì đây là cái tuyến đầu mà người dân thường tiếp xúc khi mà có các cái triệu chứng dịch bệnh. Và cái thông điệp mà chúng tôi muốn xây dựng thông qua cái dự án này thì nhắm tới từng các cái đối tượng cụ thể. Với cộng đồng thì chúng tôi mong muốn rằng là cộng đồng hãy tiếp tục duy trì các cái biện pháp phòng ngừa ngay cả khi mà dịch bệnh đã được đẩy lùi, như là đeo khẩu trang này, vệ sinh chân tay này, thế rồi là giãn cách cần thiết, và đặc biệt là mong muốn họ có cái sự hợp tác trong cái việc khai báo y tế, bao gồm cả cái việc cung cấp các cái thông tin cho các cái cơ sở y tế tư nhân khi mà được yêu cầu.
The ease of social distancing, the illegal immigration, and the new cases of unknown sources of transmission inside the community in the past few days have set an alarm to risk of disease outbreaks. The PEPFAR project is a strong call for the mutualization of private health units through assessment and training programs for health capacity building the process of reporting samples of suspected and infected cases, essential hygiene supplies, and communication at the facility. Greetings from Sharing Vietnam on VTC10 Net Việt. So far, the majority of COVID-19 suspected or infected cases have been detected by the public health units, and the participation of the private sector remains limited. Meanwhile, the private health sector, including the private medical facilities and pharmaceutical shops, with the advantage of nationwide coverage and they are in direct contact with the people, they should play the key role in disease prevention. In particular, the private health sector must be a strong channel of communication from the government to the community and early detect suspected cases and infections in the community. To learn more about the message of the project PEPFAR, today we will have an online interview with Ms. Phoebe Spur, Health Development Specialist at the British Embassy in Vietnam. So thank you for joining us. In August 2020, the Population Service International in Vietnam, PSI Vietnam, launched the project Mobilizing the Private Sector Engagement in Public Health Response, abbreviated as PEPFAR. Currently, Vietnam is still facing the control of a COVID-19 pandemic. So what is the urgency of this project?
Hello, audience of VTC Net Viet. My name is Phoebe Spur and I'm the UK government's health advisor based here in Vietnam. I'm delighted to be here today to speak about the UK's bilateral health development work with Vietnam. Vietnam's successful handling of COVID-19 is attracting international attention, with much focus on the innovative public engagement to increase awareness of personal hygiene. We all know that simple measures such as regularly washing our hands are simple and effective methods of keeping ourselves and others safe. Globally, the pandemic is far from over, and recent increases of cases in Vietnam are a reminder for us all to remain vigilant and focused on supporting efforts to contain the virus. Going forward, maintaining awareness of personal hygiene, particularly amongst vulnerable groups, will be critical to ensuring sustainable containment of COVID-19 in Vietnam and all over the world. The UK government are proud to be working with PSI, Unilever and local partners to launch this water, sanitation and hygiene media campaign promoting personal hygiene. We're also proud to support awareness raising and capacity building activities with healthcare providers and pharmacies who all play a very important role in frontline support for the community.
Obviously, with such urgency, the project PEPFAR is expected to bring practical meaning with active participation of stakeholders. So what is UK's AID's role in this project?
This water, sanitation and hygiene project, or WASH project, is an important part of our work to support the global COVID-19 response. The UK government is providing £50 million to support this project in 37 countries, including Vietnam. The UK brings a wealth of experience in delivering health development projects, and we understand the value in working in partnership with local organisations and institutions to translate global project goals into meaningful, sustainable and transformative impacts. For example, in Vietnam, we're working with experts in country on our communication campaign to promote good hygiene. We're also working with local policymakers and healthcare providers to deliver capacity building activities. Alongside this, we're forging partnerships with global private sector providers, such as Unilever, to ensure that communities have access to soap, hand sanitizer and bleach. This will make sure that people have the know-how and the means to practice good hygiene.
Well, to find out more specifically what the project PEPFAR is about in Vietnam, let's move on to our following reportage. Onion Pharmacy is one of the facilities selected by the PEPFAR project. Participating in the project, this pharmacy is instructed about the medical reporting process for customers who come to buy medicines. Obviously, this work will take more time for the pharmacy, affecting the business, but joining hands with the government, this action is very necessary.
Tôi nghĩ thì đây là bước đầu tiên để mà các nhà thuốc là sàng lọc được các ca nghi nhiễm. Và cái này là bước để bảo vệ đầu tiên cho khách hàng. Nếu như mà khách hàng có triệu chứng thì sẽ là được quan tâm và bảo vệ tối đa nhất và sớm nhất. Nên là tôi mong rằng là chương trình của mình sẽ lan rộng hơn và sẽ được nhiều người quan tâm và hiểu rõ về ý nghĩa hơn.
With a wide coverage and a flexible 24/7 service, pharmacies like Onion play an important role in providing basic medical services to people all over the region. Each private health worker is considered a powerful communication channel for early detection and screening of suspected and infected cases in the community.
Đối với lại cái đại dịch Covid thì mặc dù là mới ở giai đoạn đầu của dự án nhưng mà chúng tôi cũng rất là tin tưởng về cái sự đóng góp tích cực và có ý nghĩa của khối tư nhân. Đơn cử như ở Hà Nội, chúng ta có khoảng 7.000 cái đơn vị dược và các phòng thuốc, cũng như là khoảng gần 3.000 cái cơ sở y tế tư nhân. Thế thì nếu như chúng ta chỉ cần có khoảng 10% trong số đó chung tay thì chúng ta đã có bao nhiêu cái cánh tay nối dài để có thể hỗ trợ trong dịch. Thế và họ là những cái tuyến đầu mà có thể hỗ trợ trong việc là cung cấp thông tin cho khách hàng, sàng lọc, chuyển gửi và báo cáo để mà hạn chế được cái nguy cơ lây lan.
PSI cũng phối hợp với cả Sở Y tế và các CDC các địa phương để rà soát và thiết lập cái mạng lưới cơ sở y tế tư nhân trong các khu vực có nguy cơ và rủi ro cao. Tiếp theo chúng tôi tổ chức cái hoạt động đánh giá năng lực và tính phù hợp đối với chương trình phòng chống Covid-19 cho khoảng 3.000 cơ sở y tế tư nhân trên địa bàn 4 tỉnh, thành phố. Và sau khi đánh giá cái năng lực thì chúng tôi cũng triển khai việc phân phối khoảng 100.000 sản phẩm vệ sinh cá nhân cho dự phòng Covid-19. Ở đây là xà phòng và gel rửa tay khô. Tiếp theo thì chúng tôi cũng cùng phối hợp với cả y tế địa phương thiết lập một cái hệ thống chia sẻ thông tin giữa các cái cơ sở y tế tư nhân với nhau và phát triển một cái chương trình đào tạo trực tuyến tích hợp trên cái nền tảng xã hội cho các cái đơn vị y tế tư nhân trong dự phòng Covid-19. Và cuối cùng là chúng tôi xây dựng chương trình khuyến khích huy động sự tham gia của y tế tư nhân trong việc chia sẻ thông tin tư vấn cho khách hàng về dự phòng Covid-19.
Coming back to the online interview with Ms. Phoebe Spur, it can be seen that the ongoing project is still facing many difficulties ahead and needs more efforts from the stakeholders. So, as for the government of Vietnam, do you expect the government of Vietnam to create more favorable conditions in the project implementation so that the implementation process will be more favorable?
Policymakers play a key role in ensuring the impact of a development project, often through building or strengthening regulation and policy that ensures the long-term sustainability and local ownership of a project outcome. We are proud to be working with the Vietnamese partners on this project and are grateful for their continued support and engagement within the project activities. The UK government championed a development in partnership approach, which sees our development programmes as a way of promoting dialogue and sharing of good practice globally. Later on in the project cycle, we'd love to share lessons learned with other country partners, and we hope that Vietnam will be actively involved in this, as they already are within many of our other development work streams.
In the future, will UKAID continue to support the expansion of the project as well as other similar projects related to disease prevention and control?
The WASH project will be expanding to include 8 new partners and 20 more projects. As the second largest health donor globally and a science and innovation powerhouse, we see it as part of our responsibility to work with international partners on healthcare issues. The UK has already committed £6.5 billion through the United Nations and other bodies to support global efforts to develop safe and effective treatments, diagnostics and vaccines for everybody who needs them. And we're really proud of the life-saving research and development collaboration being undertaken by UK and Vietnamese organisations. For example, Oxford University Clinical Research Unit have supported the Vietnamese Ministry of Health with a clinical treatment trial for COVID-19. And the University of Bristol have provided technology which has supported Vietnamese company Vabiotech in developing their vaccine candidate, which is showing impressive results in clinical trials. Last month, we were proud to support a vaccine policy workshop with the Vietnamese Ministry of Health alongside PATH, US CDC and the World Health Organization, and we hope that this will support Vietnam in developing effective vaccine regulation. UK aid is continuing to make meaningful and long-lasting contributions to Vietnamese society, including our Prosperity Fund Better Health Programme, which is addressing non-communicable disease burdens and harnessing the power of digital health. Also through our Fleming Fund, which is addressing the burden of antimicrobial resistance, and our Newton Fund and Global Challenges Research Fund, which is forging a bridge between leading UK and Vietnamese scientists.
Once again, thank you for joining us today and we hope you stay safe and success with your project PEPFAR.
I'd like to thank VTC Net Viet for having me on the programme today to talk about these important projects. Thank you and goodbye.
And that's all we have for this episode of Sharing Vietnam today. For comment and feedback, don't hesitate to write to us at sharingvietnam@netvietTV.net. Thank you for watching and goodbye for now.